Good afternoon, everyone. I'm Susanna Cliburn from the Canadian Chamber of Commerce. Thank you for joining us today for Get Ready's Workplace Infection Prevention and Control Program webinar. With us today is Scott Ashley, the president of Get Ready. Scott Ashley's background is as a paramedic, and he was actually a paramedic on Ontario's Orange Air Ambulance Service. And he also worked in the United States as a paramedic as well. Scott's built on his experience in the creation of businesses that focus on first aid training and emergency management. And Scott has prepared pandemic plans for hospitals, several Fortune 500 companies, as well as some smaller firms as well. The objective of today's webinar is to have you leave with concrete tips on how to operationalize a safe and compliant reopening of your workplace or business. Scott's going to take us through a presentation that looks at what businesses are thinking through as they move towards reopening. Before we get started, I'd like to thank the Canadian Business Resilience Network partners that have made this webinar possible, and of course, in particular, Get Ready, who is today's presenter. So let's get started. Scott, over to you.
Thanks, Susanna. So welcome, everybody. Thanks for taking the time to attend today. I know there's a lot of different webinars that have been going on for the last number of months, and you know, people are searching and looking for ways to implement programs and find out the answers to some of the ever-changing issues that are happening with this whole COVID-19 pandemic. So I'm going to begin. Our company, Get Ready, we actually have it's a lot more than just myself. We have an excellent team. Our medical director, Dr. Mike Christian, is world-renowned. He's currently the medical director for the air ambulance program in the UK. He's led Canada's response to several outbreaks in terms of in Haiti and so on. And he was involved with World Health and CDC and Public Health Agency with managing Ebola. And so we've got a very diverse group. We have critical care paramedics and critical care nurses, occupational nursing staff, and so on. Police, tactical, fire rescue. We've got a lot of different personnel. We develop a lot of emergency response programs. On the screen right now in front of you is our software. For years, we built lots of binders. And at the end of the day, everyone wants the information on their phone, and that's what we've done. So we have literally thousands and thousands of pre-drafted emergency procedures for what do people do during fires, floods, spills, bombs, shooters, whatever the scenario. We've been building business continuity plans and emergency operations centers for about 10 years now. And we've been doing pandemic planning. And I was involved in a lot back, in 2006, between that and 2009 with the H5N1 and avian bird flu and so on. And we set up a bunch of national programs at that time, and people were buying Tamiflu and Relenza, for those of you that remember that. But over the last 10 years, we've been developing pandemic programs for hospitals. And, you know, it was back in January, we were all looking a little bit at the news. What was happening was actually before Christmas, but just in January, we were on a team call and we thought, you know, we better start to pivot our pandemic planning program to something that was more rapidly deployable. Pandemic planning can take a lot of time. And because the COVID virus was actually here and was happening and people were shutting down offices, and if you remember, you know, when they announced that this March break was going to be extended 2 more weeks, a lot of people were amazed. And, you know, so there's a lot of things that have gone on in the last number of months. But our program is really designed to do a few things very quickly. It's to give employers, you know, a program that makes them compliant, it makes employees safe, and it makes the public and your customers confident in terms of coming to your business or working with you. We organize it through consistent messaging and procedures so that everyone has the confidence and understands what to do. The rapid deployment is one thing I mentioned, and we want to make sure that it's easy to use. We don't have time for webinars and all kinds of workshops to get it sorted out. It's like, this is a pre-drafted program. It's ready to go. It can be customized, but it's also ready to go off the shelf. So if you need a procedure to send a worker home or to set up a screening program or your cleaning and disinfecting protocols, training around PPE use and so on, then it's ready to go. And we offer certification. I'll talk a little bit more that as we go along here. So the big thing is, and people are wondering what all this looks like, and they're having lots of different meetings, and we're not sure, and we're waiting for the government. And really, at the end of the day, hospitals have had what's called infection prevention and control programs, for close to 100 years, almost since the Spanish influenza, back in 1918. The IPAC program, as they're called, this is what hospitals do. They have an IPAC manager, an IPAC program specialist, who just looks at communicable diseases within the hospital setting. And they're looking at the disease characteristics. They're looking at things like, transmission and incubation. They look at what is the PPE that's required, personal protective equipment, how they report to public health, treatment protocols, all these kinds of things. They've been running in hospitals, and for pretty well everyone we know has been into a hospital at one point or another. And if you go in to visit somebody, if they're in the ICU, maybe the staff will advise you that to go in and see this person, you need to put on a mask or a gown or wash your hands or do this and do that. And people do what they're told and they follow, and it works very, very well because the hospitals have been doing this for a long time, and we're all very comfortable with it. Now, IPAC, or infection prevention control, is now required in every workplace because of COVID. And that's all we're really adding. We should be able to have business relatively back to normal with infection control procedures and protocols and practices. So what we do, and this is sort of how we outline our program, but I'm hoping that as we go through this, it'll give you things to think about and how to structure your program and so on. So we start with a workplace assessment. We look at things like what are the legislated requirements under WSIB or Occupational Health and Safety, Ministry of Health and so on, Ministry of Labor. If you have equipment, for example, with your staff, if you've given them hand sanitizer, if you've given your staff masks, you must train them in the use of these things. Just like if you gave someone a harness or if you gave them hearing protection, you would have to train them in the use of it. And this is no different. So we look at those kind of legislative requirements and what's needed for employee safety. We look at all of the outlines, the guidelines, the medical directives as coming down from the Public Health Agency of Canada and each of the provincial ministries of health and public health. And so we want to say if and for some of you in Toronto, we now have to start wearing masks indoors. Other places are opening up a little bit. Other places are closing down. And so, we need to be aware of what's happening and make sure that our program complies with those procedures. We continue to update the program. We also have a component on lease obligation review. A lot of tenants, they have a lease with the landlord, and you really want to go through that and make sure that what you're getting in terms of if you have a cleaning service coming in, does that cleaning service that's going to be in your premises, do they have a screening process for their own staff? Do they have their staff wear PPE when they're in your office environment? If they have an outbreak, if they have someone test positive, do they notify your tenants? These are the kinds of things you want to be checking on, and how you're sharing entry into the building and screening and things like elevators and common spaces and stuff like that. So that's the assessment. Part of this is, and people talk about screening, and we've seen lots of different things in the news, companies putting in thermometers and thermal scanning. Over 50% of the people who have the COVID-19 virus are asymptomatic, which means they do not have any signs and symptoms. So how do we screen for people that don't have a fever or a cough or breathing problems, aches and pains, headaches and stuff like that? The bottom line is we really have to assume that everyone coming on site might have the infection. As a result, we do what hospitals do, we do what the paramedic programs do, and EMS, fire, police. We look at the risk reduction. And this is how we examine a workplace here, and I'll show you this in a moment as I bring up some floor plans to give you a demonstration. But the first rule is distance. And as you know, right now it's 6 feet, it's 2 meters. The basic premise behind that is the average adult can cough droplets up to about 6 feet. And that's why we want to keep people apart, at least 6 feet. If we can't keep them physically apart by up to 6 feet or more, then we may have to have them in the same space at different times. And so the simple example in a restaurant might be that the prep cooks would come in the morning, the cooks in the afternoon, and the dishwashers at the end of the day or at night. Or if you had a delivery, the person would arrive, they would deliver the product, they would put it in a marked landing area or cage or something, and then they would leave, and then a staff person would come up and get that delivery or product or whatever, because the courier was no longer in that space. If that's not available, then we look at engineered barriers. People see lots of plexiglass. That's one method, but there's a lot of design around keeping people safe. And if we can't do any of that, then we have to start looking at PPE, masks, and visors and things like that. So we don't want to start with masks. We want to end if we can't fix it with time and distance and barriers. So this is an example of a floor plan. This is one we did down in Niagara Falls through the Ryerson Spark Innovation Hub. And what we did is we took their floor plans, we took all their current seating and flow, and we measured it out. And now you can see this is a new revised floor plan. The blue is the tables and the brown is the seats. And so I'll just move my cursor here in the middle. This table here would have had 6 seats. It now has 2. Different signage and usage around the kitchen areas and the coffee and the access and the entry points in terms of screening people, the availability of hand sanitizer and so on. This is an example of what we did for a number of small businesses. This worked out very well. A lot of small businesses that we were working with, the BIA down there, the Queen Street BIA, they're all typically the same size. They're all along, sort of the main street, in this case, Queen Street, but, they're all roughly 1,200, 1,400 square feet. They all had the front door. They had a back door for staff, a common sort of counter arrangement. It could have been a little closer or further from the door, but essentially that's the system. And then what we did is we built models for them. And so we created the signage. Where do people stand? And so that if a consumer comes up, the cashier moves back while they set their stuff on the counter. Then they're behind the plexiglass. They can ring through the order. When the person's ready to pick up their stuff, they move back to a safe position. The customer picks up their belongings, their new purchase, and leaves. And so we have the related signage and the flow and the procedures so that people can work safely and be compliant. We partnered up with a number of other groups to really be able to give a complete end-to-end program here. So through Protect Your Office, Devoncore, and a number of companies, we've been able to bring in, here's some hand sanitizer panels. Here's a different version of that. We don't necessarily want the hand sanitizer sitting on the counter or on a table or whatever. Complete disposal system. So here's the wipes and disposals and gloves. Another version of what that looks like. The engineered barriers. This can look at many, many different sort of shapes. We can add extensions onto, and this isn't the work that we typically do. We do it through our partners. Our focus is on sort of the medical advice around the outbreak, and then we look to our partners to help provide value-added services. And because of our connections in EMS and in health, we know a lot of the PPE providers and these groups, and so we're able to vet them and provide good value. But this is part of our routine, is to go in and measure. We can do it remotely. We don't need to be on your site. We've done national programs, and we can do it all online. So looking at the office space, looking at the environment, we can develop those and the procedures you'll need. We have engineered barriers, calling walls, and these can be anything from whiteboards to other boards that can be marked up or used. And just really is to provide it's a safe passage for people in the hallways, so they're not looking over at people at workstations and possibly infecting them. So we have also developed a whole program around PPE. As I mentioned, we had one client, they sent me a quote they got from a client, and it was, or a vendor, I guess it was for $67,000 worth of PPE. And when I first looked at it, I thought, wow, that seems a little high. And so we got them in touch with one of our supplier friends, and I think they were able to buy it for $46,000. So they saved $21,000 on an order, which was a significant thing. And they're just starting out, so they're going to be placing a number of orders over the next number of months and year or so. So, anyways, there's different programs and tools to help your staff, help your offices, make sure that you have the products you need on hand. This is an app that we developed. It's called the Get Ready Emergency app. In here, we have all the treatment protocols that you would basically take in first aid, anything from CPR, using an AED, stopping bleeding, an EpiPen, how to give Narcan, all that kind of stuff. But we've also added in all the videos on how to use a mask, how to don and doff. It's called donning and doffing, as opposed to taking off or putting on a mask, gloves, how to do proper hand hygiene. When people are given hand sanitizer, oftentimes you'll see them, they'll pump the little arm there and they'll get a little bit of gel in their hand and they just rub their hands back and forth quickly. And, that's really not washing or cleaning your hands. You have to get in between your fingers. You have to clean the backs of your hands, thumbs, all that kind of stuff. And so they need to be shown properly so that, again, it's compliant with ministry requirements. All of the training can be done on this app, and the staff have this on their own phone at all times, and they have access to all the information and emergencies, and it's a very helpful tool, and it's an easy way to roll the program out to your employees. The signage is consistent. We look as part of our assessment to determine the maximum occupancy, maybe of a training room or of a boardroom or a certain area, warehouse, customer area, whatever. We look at the assessments. We have a weekly call with our clients to update the programs as this evolves. So we'll be changing information and making sure that all of our clients are aware of what's going on, so that as this thing continues to move, they're getting the right and sort of really what we call operational information. Ultimately, once the program is ready to go, the client has access through the cloud to our desktop where they have all the procedures. There's about 180 different documents. So for example, if you had a person who phoned in and said, I've just tested positive, and they were in the office yesterday or at the workplace, the question isn't really what would you do? The question is, what exactly would you do? And here, so this is what the staff person has to do. This is what the manager would have to do. This is how long you have to call the Ministry of Labor, Public Health, how you're going to now deep clean that area, how you're going to begin a backtracking form to track this person down. So all of these procedures and tools are available on the desktop. They're available on the mobile, and as well as we oftentimes produce a playbook that's sent out to the staff. The infection prevention control training is a critical part. And, for many organizations, it's switching their operation to now including a workplace that has an infection prevention and control program. And that's really all this comes down to. It's actually very simple. Our experience is almost every company we deal with doesn't have the medical confidence or experience to sign off on it. And we become essentially your IPAC partner. So part of it is to get people understanding the terminology, the training, what they need to do, how they need to do it. And this 30-minute online training is available to all the employees then, so that they can complete the training. And this goes towards the company certification. Real-time tools in terms of attendance reporting and who's sick and which site and which department and why they're sick. This is important for management. It's important for your business continuity in terms of redirecting resources at any given time. It's also important for payroll and HR, determining the cause of the illness and which account they're paid from, whether it's sick time, loo time, vacation time, or if it's COVID related, it may be getting some refunds back from the government. We have the exposed person backtrack app. Very powerful, because ultimately, if you have staff that become exposed, We want to prevent a cluster outbreak from occurring. We want to prevent a widespread outbreak within your company, but also within your community and the families. And when public health gets involved to do contact tracing, the fact that you have a bunch of information and contacts is greatly appreciated, and it speeds up their whole process. The final piece of the certification is a daily status report. This is filled out every day, typically by facilities. Takes them about 2 minutes. They do it with their phone, just to confirm screening, physical distancing, availability of hand sanitizer. It's also checking the schedules for cleaning and disinfecting. And pictures are taken, it's time-stamped, and it's sent in, and you can see across your company every site. You can see that you're compliant, and if there's ever a thing, because now COVID is now a reportable workplace illness, if the inspectors come in to have a look, you have the records of when it was done and what was going on within your company, and it's a critical piece of the certification. So at the end of the day, the goal is to certify the people, is to make the employer compliant and reduce their risk, make sure that the staff feel safe and comfortable being there and are doing things appropriately, and that again your customers have the confidence to come and work with you in your business. So so that's really what the program's about. That's the intention of it. It's not meant to be overwhelming. It's meant to be deployable and hopefully easy enough that people aren't caught up in all the little details of what if, what this, and what about that. It's very straightforward and focused. So what I'd like to do is just see if there's any questions. Anyone have any other comments or thoughts?
Hi, Scott. It's Susanna. I have a question about this, and can you give us an idea of what the cost would be to have, a relatively tailored plan done for my small? Let's say I'm a small business. What are we looking at in terms of the time and money involved in doing a plan for my business?
Yep. So typically, so to give you a sense of this, we've done obviously a bunch of different plans, but plans with let's say companies of more than 50 people up to 200 people, give or take. Their annual costs and sort of timing on this is around $10,000 to $15,000 a year. That includes the training and the certification and the help. What we've done is we're sort of in the process of expanding this piece out, but for smaller business groups, we deployed one down in Niagara Falls area, and it worked out to $500 per business per year for the certification. And so it was because we've been able to standardize the tool, standardize the training. It's become very simple for people to get the information, roll it out. They're responsible for getting their own signage. They're responsible for their PPE and things like that. But for us to come and give them the toolkit, give them access to the information, do the training, it's very achievable, and we try to keep that price down.
So I guess following on that, so again, the economy, as you mentioned in your presentation, is they're opening. They're going stage 1, stage 2. Then you've had to have some pockets where actually you've had to have people, regions step back because there have been outbreaks.
Yes.
What's your rule of thumb for businesses who want to who are interested in pursuing this in terms of, and I know the answer is going to be yesterday, you need to start thinking about this, but realistically, if I wanted to open up, let's say August 1st, when should I be thinking about, bringing your company in to work with me? Like, what's realistic in terms of time?
So yeah, no, that's a really good question. We've just finished a group, but they've got a number of sites. They've got about 500 employees, and to go through the assessment and the conversations with those groups, that takes, it's taken us a week, but it takes about a total of, 4 to 6 hours. Once they have that information, if they decide to build it themselves, it'll literally take them another 6 or 8 weeks. If they decide to use the toolkit, we could probably deploy it within a couple weeks for them. Because if there's a bit of customization and adding their floor plans and things like that and so on, that we would. But it's not hundreds and hundreds of hours. It's not, this is not giant hospital pandemic plans. These are infection control procedures. It's really more about, there's different aspects. We want to make sure that you communicate effectively to your staff. What's the new rules? So that when you develop a new procedure, if you leave your desk and walk around, you will have to put on a mask. For example, you will have to self-screen from home. You may have to go through a screening process in the office. You will not have access to the microwave and to the toaster, and you will have access to coffee. And we have a process around that that's very clear. But there's a lot of changes, and all of our clients, what they're doing is they're sending out an information package to their staff. They're wanting their staff to make sure that they read it, they acknowledge it, and they sign that they will follow the new rules. And it's important because people go, well, I didn't know that. Well, no, yes, you did know that. And what we don't want is other staff feeling anxious when someone doesn't wear the mask or comes into a room or passes someone in the hallway. They don't want that. That's the number one issue. And the surveys we're hearing from our clients and the groups we're working with, they want to make sure that the company has a good plan because they want to make sure that everyone follows it.
I see Scott B, so go ahead.
Okay, perfect. Sorry, the question was just about the certification through the training. How do you justify, or not justify? Sorry, that's the wrong word. How do you show that the employee was given the education and the certification? Is there like an exam component?
Yes. Yeah, we have a learning management system built into our application. We train thousands of people every month in different programs, and each employee would be sent their own link with their own login that would cause them to go in. We typically run a series of short videos. I think this course has 7, approximately 3 to 5 minute long videos. And they watch the videos. Each video has its own little quiz. The quizzes are set up in a randomized manner that Accreditation Canada confirms is appropriate, and we can demonstrate proof of understanding, not necessarily just proof of attendance. So each staff person would have to pass and would be issued a certificate.
Perfect. So I have Barbara has the next question. So Barbara, your line is unmuted.
You mentioned that you have panels that can fit on existing workstations, but where are you finding the detail of how high the panels actually have to be?
Yep. So currently what we're doing is we're using what the hospitals are using, and we're going with 5 feet 5 or 5 feet 6 inches, so 66 inches from the ground. So if the desk is 4 feet, then you would need an extra 1.5 feet of plexi on top of that to take it to 5.5 feet.
Okay. Are there any other questions for Scott? Okay. My question of you would be, now you mentioned that you had done a collective certification training with the Niagara Falls BIA, and what would be the process? Let's say if we have a chamber. I believe we have the Sault Ste. Marie Chamber on board participating in the webinar this afternoon. if Rory wanted to do something similar in Sault Ste. Marie for his members or a subset thereof, what would be the process for organizing that? And I just go back to the question of how long how long would it take to sort of get you to get them to be trained and get up and running?
Right. So the goal would be to, within the chamber members, to demonstrate, not only for the employers and employees, but really to the community and to the visitors and to the tourists and the people coming into town, that your business core is ready, and that you have a plan, you have procedures in place, you have consistency across the community, or across the business community, so that if a person came in to buy some clothes, if a person came in to have their hair done, if a person came in, to get lunch or get a coffee or have a beer, or go for dinner, or do whatever they're going to do, buy a t-shirt, whatever, they're coming into that store. We want to make sure that you're giving, as a community, the clear messaging. So we want to have occupation limits, so that one store doesn't have 60 people in it and the next one only has 2. We want to make sure that as the public begins to move from site to site and store to store, they go, oh, I have to wash my hands. I have to hand sanitize when I come in the door. In other words, we want everyone coming into our workplace, we all want that, but we want them to do it safely. So when they open the door, wash, sanitize your hands, and you now are entering the store, the business, with clean hands. Then how you check out, make sure that you're not getting too close to the cashier, that there's a way of doing it. And so, you can, and it's a bit of back and forth. It's sort of a choreographed event. The cashier backs up, the person sets their belongings. This is what we did with the LCBO, for example. So they'll set their belongings on a counter. Now the cashier, once the merchandise is set on the counter, the customer either gets behind the plexiglass or steps back. Now the cashier can move forward. They can now clean, or not clean, but they can scan the products. They can then put them in the bag. Then they step back again. The customer comes forward and pays for it. Then the customer takes their merchandise that's already prepackaged now, and they can leave. The cashier moves forward, washes their hands, sanitizes the area, and the next customer starts again. And so it's always sanitize, activity, sanitize. And this is what nurses do, this is what doctors do, this is what paramedics do every single day of our lives at work. And this is now, because of COVID, what workplaces have to do. We want to make sure that people, you don't need to be wearing gloves because you wash your hands. If you didn't and you wore gloves, you would have to wash your gloves. So wearing gloves, unless there's body fluids, unless you're the first aider on that work crew, you don't need to be wearing gloves. It's unnecessary. We see people wearing visors, and that's not a bad idea, but it's not the only thing you need to wear. Then you still have to wear a mask. You can cough underneath a visor. You can breathe underneath the visor. So you have to, if you're putting on a visor, that's fine. It'll remind you not to touch your face, which people do very, out of habit. But you have to wear a mask, and if you wear the visor, that's fine. If someone else is coughing or near you, you might feel a little more comfortable. If you were in a high traffic area, if you had a visor on, but you still need to have a mask. And regardless, the employer has to teach all the staff how to use the PPE. That's a requirement. So we see people trying their best, they're doing certain things, but it's actually not to a protocol. And so these are risk-based assessments that we bring in as paramedics, as hospital members, who have built infection control programs. And that, at the end of the day, I think that's really where this program moves to, is it gives the non-medical people in the company the confidence to sign off. It gives the staff the confidence to do it. So with a chamber group, just think if you went down the street, one store to the next store, and they had the same signage, they had the same procedures, it would very quickly teach them how to shop in their community and how to keep your staff safe. That whole program, you could roll out. We did 12 stores in one day, but literally we're just looking at sort of how that toolkit would even be a little easier to deploy. you could probably do several hundred stores in a week. So that becomes it becomes an important message, right?
And Scott, do you also cover, you mentioned requirements. I had my first patio dinner out last night, and the restaurant asked us, said they were, this is in Ontario, that they were obligated to ask each and every person coming to eat there for their name and phone number in case they needed to trace people. Do you cover in your program the liability of the business in terms of what's required and what is kind of not? Just so it's very clear that these are things you absolutely have to do and could be held liable to. Is that part of your training at all?
Yeah, 100%. No, anything that is legislated requirements, especially under occupational health and safety, we make sure that that capability exists for the employer, that they have those check boxes, because they don't want to not be compliant. They don't want the Ministry of Labor coming in and shutting them down and, handing out fines and penalties. And, we don't want people being exposed. And they said, well, we never did this or we never did that. You want to have that validation. And so we measure that. When it comes to some of the medical requirements, in medicine, it's often called guidelines. So, for example, if you look at the Heart and Stroke Foundation of Canada, they will say that it's not a standard of doing CPR; it's a guideline. So, for example, you can do 30 compressions in 2 breaths. That's a guideline. If you do 25 compressions in 2 breaths, no one's going to get mad at you, right? Because it's not the standard; it's a guideline. Now, with the public health guidelines of 6 feet and the guidelines of social distancing and things like that, these are things that everyone feels will become legislated requirements. Because the government hasn't had time to sit, because they haven't had time to pass them into laws, and for those, anyone in health and safety, they all know every province has their own little Occupational Health and Safety Act book that lists all the different requirements. Everyone believes that there will be a new section in that book soon, but it's not there now. So we look at not just the legislative pieces, but we look at the guidelines from the public health agencies across the province. And if they're saying you should be 6 feet apart, if they're saying you should be socially distanced, if they're saying you should wear masks, and so on and so on and so on, we want to really support those medical initiatives to make sure that the employer is doing the safest thing, because ultimately that's what they're going to be held to. The employer has the responsibility to do everything reasonable to ensure the safety of their employees. That's right in the Act, and it's a pretty broad statement, but it goes for fire plans, it goes for all kinds of different things. And that's even, when we look at this and we look at barriers, within the floor plans and flows and the movement of people throughout the facility. Fire planning is a big part of what we've always done as a company. And it's a piece that we always want to make sure we can still sign off on, to say that this plan has not barricaded an entrance or an exit. It's not made a hallway too narrow. We've looked at the handicap requirements and disabilities and so on to make sure that someone could get a wheelchair, down this hallway and things like that. So all of those, there's a lot of moving parts to this, but these are the new normal. These are the things that companies have to start sorting out, right?
And I am going to wind up by thanking you, Scott, very much. And thank you to those of you who joined us today. Thanks, Scott, your team, and everyone on the call today. And we hope that everyone stays well. Thanks so much.
Well, thanks again. And thanks everybody for taking your time. Hope this was helpful.
Bye-bye.
Take care.